We start with the introduction of tuberculosis. What is the tuberculosis? Tuberculosis is an ancient disease caused by Mycobacterium tuberculosis, and it is a contagious disease. Recognizing the tuberculosis risk factors such as vitamin D deficiency, it is required to target the protective strategies. Tuberculosis usually disturbs the lungs, but it can also distress the kidneys, brain, spine, or intestines. India have a substantial contribution of 1/4 of global tuberculosis burden. Tuberculosis has very ancient origins, and it currently infected nearly 2 billion people all around the world. Vitamin D is well recognized for its role in bone metabolism and calcium homeostasis. Vitamin D increases the immunity in host system. Vitamin D enhances the antimicrobial activity of monocytes and macrophages. Now we discuss the background of it. Tuberculosis is an infection disease caused by the bacteria named Mycobacterium tuberculosis. Nearly 10 million people develop this disease annually. TB mainly disturbs the lungs, but it can also distress the other organs of the body except nails and hair. Due to increasing resistance and longer duration of treatment of TB has posed a challenge to mankind, so a new approach is to look towards strengthening the host immune system. Vitamin D supplementation in tuberculosis is one such approach. Most of the studies included only pulmonary tuberculosis, but the objective of this study is to assess the correlation between vitamin D and tuberculosis, pulmonary and extrapulmonary tuberculosis. However, due to higher cost of antibiotics and risk of antibiotic resistance with increasing incidence of multiple drug resistance or called MDR and extremely drug resistant XDR, so it has encouraged to use vitamin D supplementation in the treatment of tuberculosis. Vitamin D is an important regulator of the immune system, and vitamin D influences the pathogenesis of TB through multiple mechanisms. At the level of macrophage, vitamin D is involved in cathelicidin and interferon gamma IFN gamma mediated activity against Mycobacterium and induction of oxidative species and promotion of phagolysosome fusion, which leads to the degradation of mycobacteria. Higher vitamin D status in tuberculosis patients have higher immune activity and less serious tissue damage. Now, the diagnosis of tuberculosis include the following tests. First one is acid-fast bacilli test or AFB. It will be performed to detect the tuberculosis. Next one is TB and AA or cartridge-based nucleic acid amplification test. It is an automated cartridge-based technique which will be used to detect the tuberculosis. Next one is pleural fluid analysis. It will be used to find the cause of the pleural effusion and to detect the tuberculosis in pleural fluid. And the next one is cerebrospinal fluid analysis. Cerebrospinal fluid analysis is a group of tests that look at the cerebrospinal fluid to diagnose a disease and infection that affect the brain and spinal cord. CSF analysis or cerebrospinal fluid analysis will be performed to detect extrapulmonary tuberculosis in brain and spinal cord. Ascitic fluid analysis, it will be performed for diagnosis of tuberculosis. FNAC or fine needle aspiration cytology, it will be used for diagnosis of tuberculosis. Next one is lymph node biopsy. It is a test in which a lymph node or a piece of a lymph node is removed for examination under a microscope, and it will be performed to detect the extrapulmonary tuberculosis in lymph nodes. Then we will perform the imaging techniques such as a CT computed tomography scan or MRI magnetic resonance imaging, ultrasound or nuclear medicine imaging including positron emission tomography or PET will be used to see the inside images of body organs such as lungs, brain or spine wherever required to detect the tuberculosis. After the diagnosis, patients with pulmonary and extrapulmonary tuberculosis will be detected. Then we will do the assessment of vitamin D level. All newly diagnosed tuberculosis patients will be further subjected for evaluation of vitamin D levels by drawing 2 ml of venous blood from each person. Chemoluminescence method will be performed. In this method, the centrifuge sample will be assessed for 25-hydroxy vitamin D, or we can say it is an active form of vitamin D. The results will be expressed in picogram per milliliter, and those with values 20 to 30 picogram per milliliter will be considered as vitamin D insufficient, and those with less than 20 picogram per milliliter will be considered as vitamin D deficient, or we can say VDDD. Data analysis and interpretation. For the data analysis and interpretation, we will use a Microsoft Excel, and we will enter our data in Microsoft Excel, and by using the statistical package for SPSS or statistical package for social sciences, data analysis will be done. If we discuss about the results, the clinical profile of the study population will show that the level of hemoglobin, oxygen saturation, and albumin will be lower in the cases, or we can say in the patients of tuberculosis, while the level of these parameters will be higher in the controls, but the white blood cells count or WBC's count will be lower in the controls than in the cases. The level of vitamin D will be lower in the TB patients. The mean vitamin D levels in the tubercular meningitis will show the lower values as compared to other forms of the higher vitamin D deficiency. The higher vitamin D deficiency is associated with more severe disease. Hence, vitamin D can be used as a cure to treat the TB. Results will show the presence of nutritional deficiency, especially of vitamin D, in both pulmonary and extrapulmonary tuberculosis patients. Study will highlight the presence of low vitamin D levels in tuberculosis patients and necessity to correct them to achieve a better cure rate. Vitamin D possesses immunomodulatory activity and it activates the expression of cathelicidin, and it is involved in the release of cytokines, and cathelicidin activates the macrophages which show antibacterial and antiviral activity. Vitamin D's deficiency will indicate the tuberculosis and will be used as a cure to treat the tuberculosis.